Welcome to 2021 and our newest BioME Virtual Coffee Hour, first one this year. We're very excited to have amazing speakers today. If we can ask for everybody to stay on mute, that would help us a lot. So this is our first coffee hour this year. We are planning to have one either every month or sometimes we might have some other events, but basically we will continue our coffee hours all through 2021, no matter what happens. And the way we're going to do today's event is, as always, first you need to listen to me just saying hi to you. My name is Agnieszka Carpenter. I'm the Executive Director of BioMaine, and BioMaine is Bioscience Association of Maine. We're a trade industry group, and our mission is to advance biosciences and to create opportunities for the life sciences community in Maine. Then we're going to have a couple speakers, so 4 presentations, 10 minutes each, and then at the end we have about 10 to 15 minutes of Q&A. The chat function is on, and we encourage everybody to leave your questions in the chat. If anybody would like to ask a question in person, we ask that you raise your hand towards the end and we will call on you. It's totally up to you if you want to submit your question via chat or ask it in person. I also wanted to thank our BioMaine annual sponsors, thanks to whom these events are possible. So in 2021, so far, our sponsors are MTI, Consigli Construction, the Jackson Laboratory, Lanco, Propella, IDEX, and People's United Bank. We are always actively encouraging our supporters to become sponsors. So if you're interested, all the information is on our website. And with that, I think we're going to head over to New England Ocean Cluster WHOOS, because our first presentation is a virtual tour of the WHOOS. We're very excited. And our speakers are Patrick Arnold, the CEO of New England Ocean Cluster, and Janeen Arnold, the co-founder and designer. Hi, Patrick.
Hi, good morning. Can you hear us all right?
Yeah.
Excellent. Well, welcome to the WHOOS. And again, I'm Patrick, and this is Janeen. And just a quick background, the New England Ocean Cluster is a co-working environment and a collaborative virtual model. We're partnered with the Iceland Ocean Cluster. We're fully focused on the full utilization of our ocean and our ocean's resources in environmentally sustainable ways, profitable ways, and ways that are culturally inclusive of the workforce local to the resource. And one part of where that takes us is into bio-based industries, biotech, biomed, life sciences. So we'd like to give you a tour, tell you a little bit about some of the companies and some of the work happening here. But to kick us off, why don't I have Janeen start?
Hello, welcome. So as Patrick said, some of you may already know, we're here at the New England Ocean Cluster. We're focused on collaboration and innovation all around full utilization of our ocean resources. So using 100% with zero waste. I did design this space, so it would intentionally offer those chance opportunities for collaboration and those conversations to spark innovation. So I'm excited to show it to you. But I do want to start with one thing I'm quite excited about, and that's Biomedical. And so I do think it applies here in that the blue mussel is a fun fact that it has its own glue that it adheres to rocks under the water to withstand the strong currents. And there are some really innovative minds who have taken that and replaced the more toxic glues that are used in furniture making with using that process. So it's really exciting to think about, and some others in Korea are talking about using that in a medical way, so in the medical field. So it's really cool concept, and these are not new concepts, but they're certainly concepts that we try to encourage around here. We want to just see more development to that regard around here in Maine. So this is the incubator. We have some smaller startups that have taken up space here, but also some larger companies who already have a presence in Portland, but want to keep their finger on the pulse of the blue economy and keep their finger on the pulse of what's happening here at the New England Ocean Cluster. So Patrick can tell you a little bit more about those as we continue.
You know, there's no lab space, so I want to throw that out. But part of our science is making sure that the coffee on the inside of the walls is better than the coffee on the outside of the walls. So as we walk, you'll see some of the space, and it's really intended to be an attractant to those who want to collaborate and work together. One desk in the co-working environment sponsored by Shipyard, and that, for instance, has gone to support the startup Marin, which is a skin cream that treats eczema, extracting ring glycoproteins from lobsters. And that's Patrick and Amber who started that up. They've been on this program before, and they have a desk in that incubator. But they come here to collaborate and participate in this network.
We also have members that are really exciting, Medallion Bioplastics and some other entities that we work with that we're excited to support here. So I talked about, and Patrick talked about, full utilization of our ocean resources. So as you're going to see here, this was a model started in Iceland at the Iceland Ocean Cluster. They were quite successful, and in Iceland they use 100% of cod. Of their cod. And so we were quite inspired by this when we were there, and we're wondering how we can bring this here to Maine and inspire the people of Maine here to think about our resources and how we might use 100% of what it is that we are catching.
And this part right here is primarily what, when people talk about fishery, this is the entire thing, fish to fillet. And for 1,000 years in Iceland, that's all it was. And the heads and the guts just got thrown overboard. But they were throwing away what is now worth 3 times the revenue. They were throwing away all the opportunities for lipids and enzymes, collagen, and all of that. So we have several startups here and in Iceland who are doing things such as extracting collagen from fish skin to get into nutraceuticals and the like. And we have another company, for instance, that's been working on a skin grafting product for burn victims. So there's examples of those type of companies that come in here to plug into the network, to seek financing, seek market and sales support, but really to collaborate to advance their interests.
Yeah, our market is not just to sustain our members while they're working, but also to inspire. These folks are from the Iceland Ocean Cluster. They have the collagen and then the dropi, cod liver oil, from Iceland Ocean Cluster as well. So we hope that people here in Portland will come and see these things and say, oh, how can we do that here?
So as we walk, what we want to do is just quickly show you through the cafe space. You can see as we're opening up in this area, we have larger offices for more full-time tenants. So larger companies, Maine Center Biofuels or Bristol Seafood, even Maine Center for Entrepreneurs, they have offices in these glass offices that you see over here. But then we really want to focus on this. This is an example. We'd like to see this wall go all the way to the floor. But these are examples of companies adding value to the resource. This is one that we've been working on for the last 3 years. We work with lobster processors throughout Maine. This is dehydrated lobster shell. This is chitosan, which is a polymer, a coagulant, antimicrobial, antifungal, and antibacterial. And for us, we had just asked everybody, why hasn't Maine extracted this, which can be about $90 a pound, from the lobster shell? And then in our initial work, just seeing the universities and the companies here who can do this, nobody had gotten to the point where they could extract it. So part of the value of the ocean cluster is being plugged into a global network. And to accelerate this venture, we ended up with a consultant out of Dusseldorf, Germany, who also used the labs over at the Marine Institute in Newfoundland. And that shaved about 18 months of development time off getting the chitosan out of Maine lobster shell. So again, that acceleration didn't happen through a research grant. It happened through a variety of coffees here in Iceland, and then getting to know people on the network who can vastly move the development of your product faster. So that's a bit about what we do here.
Yeah, we like to call this our innovation wall. Again, really throughout the space, trying to inspire innovation.
So members and tenants come in here for board meetings, sales meetings, sometimes just doing off-site type work such as Bristol Seafood or Maine Center Biofuels over here. And then they share use of the boardroom and the various conference rooms that we have here. What we've found so far through COVID is actually an increase in demand because people are working far more remote, but they still want to come into a professional environment 1-2 days a week, something like that. So we're a small part of a much bigger effort, but really, really happy to be a part of the life sciences work taking place here in Maine. So with that, I think we're done with our tour. And if there's any questions, we've all logged on to Zoom, so we're going to mute ourselves. And then, Agnieszka, you just tell us when you need us to answer anything.
Thank you so much. The space is amazing. So normally we do live tours, probably about 2 a year, and I wish we could do a live one. Maybe in the future we will, and then we'll have a little party in that back room because I love it. We'll bring
Absolutely.
food.
The offer is open.
And I'm gonna try some of that fish jerky, if you don't mind. I don't know. I saw it on the shelf. Anyway, Patrick.
Yeah, we have it.
Thank you so much. If anybody has any questions about the co-working space or any questions for Patrick and Janeen, please submit them in the chat or save them till the end. We've never done a virtual tour, so that was fun. Thanks so much.
Excellent.
So with that, we're going to move to our next speaker, Dr. Khalil and Kendra Batchelder from University of Maine. Dr. Khalil is the Professor of Biomedical Engineering, and Kendra is the research assistant. So it's going to be a joint presentation. Okay. I think Dr. Khalil, you're on mute.
Okay, can you hear me now?
Yes, thank you.
The volume okay?
Yeah, just be close to the microphone. It should be fine.
Okay. So yeah, thank you for inviting us. This is my personal first attendance to these meetings. I'm glad to discover this. Christy Townsend had introduced me, and so thanks, Christy, for doing that. And so what we're going to talk about, so Kendra and I are working on this breast cancer project. So we'll say a few words about ourselves and tell you about what the project is and where we're at, which is really at a kind of a critical point where we're trying to get to commercialization based on the inventions that we've made with this diagnostic method. So just a couple of words, we are working at the University of Maine. The lab is called the CompuMaine Lab, which is an acronym for computational modeling, analysis of imagery, and numerical experiments. And so this is the lab I founded some number of years ago. And Kendra came in as first as a master's student and now as a PhD student. And I want to make sure I don't forget, so I'll mention this now before we move forward. We are extremely grateful to the Maine Cancer Foundation, who funded us through a series of grants starting in 2008 or so. And I think the last one was in 2014. And they've given us this kind of seed funding that really allowed us to get to the point we're at today. And it led us to get some next level funding. So really the intention from the foundation worked well. It's a seed funding to allow us to do the research to get us to the next level, and that worked perfectly. So many, many thanks to the Maine Cancer Foundation. So my personal background is in mathematics and astrophysics. And then I made the switch to the biomedical sciences when I did my postdoc at the Jackson Lab in Bar Harbor. And since then, I set up my lab at UMaine, and then I've been working in the lab, is working with different institutes and universities across the country and the world. In particular, in Maine, we're working a lot with obviously people at UMaine, but also the Jackson Lab and MMCRI, for example. And so we are, by nature, a lot of the work we do is collaborative. We work with other people and help them. And there's a nice synergy that usually develops. We've worked with not only biomedical sciences, we've done, for example, climate change work. We've done satellite imagery, looking at glacier recedents in Greenland, for example. We've worked with Kirsty Townsend, for example, with the nerve collagen neuropathy project. So again, there's a long list of projects. Obviously, we're interested in anyone who would like to talk to us about what they're working on. Kendra, do you want to say a few words about yourself?
Yeah, so I'm from Maine, and I attended the University of Maine for all of my education. I met Andre when I was an undergraduate student, and towards the end of that is when I got connected with his lab, and that's where I started my master's work, working on this particular project, and it's continued into my PhD work. And like Andre said, we're now at a point where We have really exciting results, and we're working towards commercialization. So all that hard work it's very exciting time.
Right. Thank you, Kendra. And what I particularly like about working with Kendra and others, I'm also working with Karissa Tilbury, who's going to be talking next, is we set up these environments where I genuinely don't remember some of the advancements that were made. I don't actually remember if it was my ideas or Kendra's ideas or Carissa's, and I think that's a sign that we're in a really nurturing environment and there's a really nice cohesion going on. Okay, so we're working with mammograms, and all the data we're going to be presenting today are coming from, actually not exactly all, but almost all data we're looking at are from actual Maine patients. So Maine women who have donated their data, their mammograms, and that comes with the radiology report and so on. And so what we've established is that previous work from the biology side of things by Biomedical showed that there was a disorganization in the tissue, not only in the tumor itself, but around the tumor, the microenvironment. And that microenvironment could dictate whether the tumor is going to be able to go off and metastase or if it's going to stay put and remain like a dormant tumor. And so we took these ideas, and this level of disorganization is something that we tried to measure at the mammogram level, so at a much larger size scale. And with these metrics coming from an image analysis point of view, computational tools, we're able to quantify this level of disruption, as we refer to it, this disorganization, we call it disruption. And in these maps that we're looking at for these two patients, we color-coded in yellow. So we can distinguish the tissue between fatty tissue and dense tissue, which is blue and red. And when it's disrupted tissue, it's not quite dense and it's not quite fatty. It's this in-between state, disorganization. And then we color code that one in yellow. And we found that there's more of this yellow in the cancer breast versus a healthy breast. And so that's what we're ready to go and work more on. So we have some advantages over the current AI and deep learning methods. Not that we're not using those. There's a bunch of contexts where we do use these kind of techniques, but here there's a lot of hype these days around these AI and deep learning methods, including in breast cancer screening and mammography. The disadvantage that they have is that they need thousands of cases to just train their algorithms. And even when they do that, it's not clear how they can provide a physical interpretation of their results. So our advantages is that we don't need to train, we can just do one mammogram at a time and we'll able to get this kind of red, blue, and yellow map. And also we have this metric that tells us whether the tissue is organized or disorganized. So there's a physical meaning that comes with our analysis.
Yeah, and I think that's important too, is that the measurement that we are calculating, actually, we can kind of work backwards and there's an actual physical meaning to it. It's not just counting pixels and making different shapes. There's an actual physical process that we're able to measure.
Yep, exactly. Thank you. So we got 2 patents issued. So Kendra and I are both the 2 co-inventors. This dates back to some of the work that we did during Kendra's master's thesis. And then we recently got a new round of funding from the National Cancer Institute at NIH. So we got now 3 years of funding that just started in September. And that allows us to integrate a lot of students in our work. And it allows us to also try to better understand what would be the link between our analysis at the mammogram level and this disorganization at the cellular level that was found by these people in Biomedical's work. Biomedical's lab, sorry. And that actually involves Karissa Tilbury, who's going to be talking next. So Karissa is a co-PI, multi-PI, sorry, that's the technical term. Working with us on this project. So what we're doing now is that as much as finding at the diagnostic point, the time point where the patient came in and got a diagnostic of cancer, we're able to discriminate between the healthy breast and the diseased breast. Our question was, this disorganization in the tissue, could it precede the tumor? And so to find that out, we're looking at longitudinal data. So we're looking at a sequence in time of mammograms And for every one of these patients, we have several of them. We look at the final time point. That's the point where the radiologist and the pathologist said there's a tumor, there's a cancer. And so we have access to those non-cancer previous time points. And we're trying to see, is there a change in the tissue that could dictate some sort of indication, right, for the radiologist that says that there's a yellow flag, literally in this case, that should coax the radiologist to say something like, you know what, let's have you go get an MRI now or ultrasound because we're seeing something suspicious. That's the kind of clinical implementation that we could see with this kind of technology. So our results are actually pretty exciting. It's a small sample size, but that needs more data. But we're looking at maybe 1 to 4 years prior to the diagnostic. We're looking at some elevated numbers in this yellow square kind of metric. And so that tells us that we might be able to pre-detect when cancer is going to hit based on this mammography screening. So we're at that level where we know what to do. We know what the path is. We know what needs to be done in terms of getting FDA approval. That pathway is actually pretty simple compared to, for example, drug development. We know that we have consistency of data. If you look at these as a function of time, you don't hit a year where, keeping in mind that this is the same patient coming back year after year, it could be a different imaging method. It could be a different company. This could be a Siemens. This could be a GE. And so having consistent data through time is a big deal. So that's important to us. And so the next level is really to get just thousands of mammograms and patient data and just launch this analysis. And then there's some more, calibration. But what's important is that we know what to do. We just need at this point, time and money. And so that's an important point. And so that's why we're really at that level where we're trying to talk to these companies, potential investors, angel funding, anything that can get us going to get to the next level.
Yeah, and I think another point is you have funding to do the actual science from the NIH, but also being able to run the parallel with it too, so that when we get a final product, the business aspect is also up and going at the end.
Right. Yep, exactly. I think, oh, that's our final slide, right? So that's me, that's Kendra. If you'd like to visit our lab webpage, you can have an idea of what other projects we have going on. And then I think we just had some notes after that. So I think we can stop here. Kendra, do you have anything else to add?
No, I think we're about out of time, so.
Okay, thank you so much, Dr. Khalil and Kendra. This was really fascinating, and congratulations on your patents. I hope that this leads you somewhere great because it has a lot of potential. So next we're going to hear from Dr. Karissa Tilbury, who is Assistant Professor of Biomedical Engineering, also at the University of Maine, who will her work is closely related to Dr. Khalil and Kendra's. Thank you. And Dr. Tilbury? Okay, we just need you to unmute.
All right, and then laser pointer people was saying Command L, but there's no command on a PC, so it must be Control L. No. All right. Well, anyway, I'm Karissa Tilbury. I've been in the Department of Chemical and Biomedical Engineering since 2017, and I put the first slide up to show it's a little dated. There's some more people now, and some people have graduated. But these are the students that have been passed to the lab, so you can see that.
Karissa, we can't see your slide anymore.
Okay, let me figure this out. All right, can you see it now?
Yeah.
Okay. All right, so the first slide is just a slide of all the people that work in the lab and help make the daily operations functional. And then also just calling a note to the different collaborators that I have had. Christy Townsend is no longer at UMaine, but I understand she still has affiliation here, so I think I can still probably say that, but I should correct that to say the Ohio State University. About multiple collaborations, and you heard a little bit of foretaste about maybe some consideration that might be granted from Andre's work. So it's pretty exciting to get to follow him. As you can see, I'm collaborating with him as well. So go to the next screen. All right, it was very delayed. So we all know that biology form and function is multi-scale. So we go from, biologists are interested in things like the genome, right? That's why it was really excited when we could finally get to know what all those that code meant. And then proteins are encoded in that, and then organelle, cells, tissue, organ, and body. So, and we know that there's complex multi-scale time course relationships that are associated with that. So if we really want to understand biology, right, we want to be able to model that. So there's people that work on just exclusively modeling that, and then take measurements to inform those mathematical and computational models to make them updated. So I'm trained as a biomedical engineer, and I'm trained more specifically in biomedical optics. So I'm trained to help provide those multi-scale optical imaging knowledge that can be used as inputs or validation of particular models that people come up with. So when you think of imaging, you probably think of things like X-ray, CT, MRI. Maybe with the advent of COVID, you've seen more imaging because people are really interested in how to understand how is that COVID virus actually getting in and causing so much havoc within all these different organ systems. So that's been a very active area. But if you look over here, this plot, I have molecular sensitivity. So we can do what we call chemical imaging, or we can tell you what sort of compounds are present in there, just like the airport security line. If you go and have additional screening and they swab things, they're looking for chemical signatures. And that's all based off of a spectroscopy, which is a sister cousin to an imaging approach where you actually see spatially where those molecules are located. So with that, we also have spatial resolution and penetration depth. And there's trade-offs behind all of these techniques. And I'm not going to go into all of that, because in a slide coming up, I'll show exactly where the spatial resolution and the penetration depth is that I'm particularly interested in. So in order to understand why optical microscopy or optical techniques might be so useful to understanding tissue organization, appreciating just the fundamental interactions that light can have with tissue. So we can have just immediate reflection off of tissue, which can actually encode quite a bit of information. We can have tissue that interacts with, we can have light that interacts with the tissue a little bit more in depth. And eventually some of those photons can be scattered all the way out and we can collect those. That's what's done in your Apple Watches, your Fitbits to get your heart rate, etc. And actually that's absorption and scattering coupled. And we can also take advantage of those absorption properties that are occurring and image them through fluorescence properties as well that require that, so they can be re-emitted at a different wavelength. So all these properties, of course, are related to how far the photon or the light is actually going to propagate in the tissue. And that is going to be the fundamental limit of how well you can resolve things with light. So if we look over here, generally just light interaction itself, you can't beat the diffraction limit. That's a fundamental physical law. But in the early 2000s, late 90s, there were some very clever people who won the Nobel Prize in 2014 for beating the diffraction limit that Abbe defined way back when, and created super res microscopy techniques, right? So using some tricks, using statistical processes, we can actually beat the diffraction limit and see smaller sub nanometer, like nanometer size things within cells and understand how things are working. And that is particularly useful for understanding how viruses get inside of cells and DNA and all those other things. So where I particularly live is in these two bubbles that I colored in here. So I live in the nonlinear microscopy world. So I'm showing you images. This is a no labeled, it looks like a histology section slide that a pathologist might look at, but obviously not colored in the same traditional purples and reds color cues. But what we're seeing here is this is actually a mammary tumor right here in this aqua blue color. And it's inside of a mouse that was being imaged intravitally. So they were particularly interested in this case in understanding how is the extracellular matrix around, shown here in green, and imaged via a technique called second harmonic generation, which is all label free. There is no labeling that occurred in this image at all. So understanding the cell collagen interaction and how that progresses during metastasis events in a mouse model. Other things that people have used nonlinear microscopy for is, of course, zebrafish development. In fact, just last week I was collaborating with Jared Telbot, a recent hire at Maine, and we were looking at a 25-hour post-fertilization zebrafish embryo and actually watching the cells migrate that are going to go create the fin. And it was really, really, really cool. And then down here, this is an image of an adipose fat pad area. And it's really fascinating to understand there's a lot of interesting things going on in terms of obesity, in terms of understanding neuropathies and all that, understanding the relationships between the collagen and the nerve fiber and capitalizing on that. So fat tissue isn't as simple as we might all think, right? Just eat fewer foods and then you'll lose weight. Well, it's much, much more complicated. It's controlled by lots of hormones. It's controlled by innervation. There's multiple different fat types that are being discovered and have different functions as well. So if you notice that over here, I have resolution. This is going to be very useful for extracellular matrix environments, right? So cell to cell proteins around them in the microenvironment. And I have pretty good resolution, submicron to micron length scales, but my penetration is not going to be very deep. It's going to be on the order of 300 to 500 microns if I use 2 photons. And if we optically clear things, I can go deeper. And if I use longer wavelengths, I of course can go deeper. And there's 3 photon processes that people are very, very excited about right now as well. So if we want to contrast that, if we want to go deeper, there's going to be a trade-off. We can go deeper, but we can't have the same resolution. So this is with a collaboration with Boston University, and I've gotten engaged in diffuse optics. So this is more similar to your heart rate monitors that you might have, but a little bit different in that we're giving you an image of tissue concentrations of oxy and deoxyhemoglobin, as well as different types of fats, lipids, and water content that can be used. In fact, there's ongoing research with my collaborator right now. He is actually trying to do a cholesterol lipid test through the skin without ever extracting any blood to understand what is changing. So if you want to be a part of that study, you get paid to eat pizza and have your hand image, and of course have a blood draw 4 hours after you eat the pizza to see how your lipid changes very rapidly. So very, very cool practical applications, particularly right now in the diffuse optics world, as we're all facing COVID and disruptions of primary healthcare. How do we continue to provide people healthcare in a safe way? Well, telehealth is a great way, right? And diffuse optics can provide a lot of information to physicians that's really meaningful, and without having to, have a person draw their own blood, for example, or have a person travel to a different site to draw blood. So this is what I'm interested in, and coupling this together. So imagine that this is sort of like the Google Earth satellite vision, right? I don't know if you like playing with Google Earth, but you can see, the Earth, and then you can zoom in and you can see buildings, and then you can see people walking on buildings. Or if you're like me, I get a kick out of seeing my car in the parking lot of Jeunesse because it's more often there than my home. But so we could do the same thing with biology and kind of get all those multi-scale information together and really help provide a clearer picture of what is going on to inform those mathematical models. So that's really what I'm interested in. And very quickly, just some projects that are ongoing. So collagen remodeling is really important for understanding the tumor microenvironment. So Andre and Kendra just showed they have a mammography technique, and some of the bit of the NCI proposal that I was most intrigued by when I came here was that's really cool that they could maybe see changes that are happening in mammograms, which is, obviously a very clinical tool that doesn't have this limitation of depth, but the resolution is really bad. So this is really playing to the strength of it's not an AI technique, because AI techniques, you don't know what it's sensitive to, but it really is rooted in a biophysical alteration. And what are those biophysical alterations? Well, that's the cell interaction with the collagen and understanding all of those, even from a level of immune cell to understanding the cancer cells, understanding normal cell interactions. Those are all coupled. And of course, all those interactions are contributing to the signal that Andre is collecting in his mammogram and analyzing in his mammogram data. So it's well known that we have healthy epithelial cells line up very organized. And in breast cancer, what happens to those ductal regions in particular frequently is the tumor cells go wild and they just reorganize. But initially what happens, it seems like you have collagen that's surrounding and it's kind of encasing like a nest and keeping all those cancer cells encased. And some women, for whatever reason, have DCIS, in ductal carcinoma in situ, meaning it's cancer, yes, but it has a not likely that it's going to go very far. But currently, we're treating them as if it is going to metastasize and usually remove it. So at some points, though, it seems like there's some interesting switches that happen, and this same collagen that was used to encase the tumor cells now becomes remodeled to be a superhighway to handle the LA traffic and allow those cells to just expedite and leave and extravate into the blood vessels and migrate to other places. So second harmonic is sensitive to this collagen structure. And then in addition to that, we can use other photon processes called optical metabolic imaging to actually understand the cellular metabolism at a single cell level. So we can map out collagen and single cell metabolism in the same image and understand if there's particular relationships about that. So that's what I'm particularly interested in. And this, of course, I think you can see how this could bridge the gap, right? This is, if we have the same patients that's matched from the mammograms to the biopsy slides, the slides that the pathologist looks at to investigate, if we can match those and find a correlation, that further empowers the mammography approach and really makes a huge impact for what it might be. So it makes mammography a predictive approach rather than saying, yeah, you have it, because currently it's sort of a reactive approach, right? We go get screening mammograms, but we aren't able to change anything ahead of time, right? You can be told you have dense breasts, but what does that mean? Can I change anything about that? There's really no option. So if we know more about the microenvironment, there's possibility that we could be more predictive and alter things without being as reactive as we are right now in the current medical treatment. So I see that my time is up. So I'm gonna stop here because I think that loops in really well with what Andre talked about. But I have more projects. So if you want to talk more about the extracellular matrix and cell and imaging of all of that, I'm always very excited to talk about those sorts of things.
Thank you so much, Karissa. I think everybody's amazed at the work that's being done at your lab and at the University of Maine. So we're going to jump to our next presentation. I just wanted to remind everybody that the chat is on and you can leave your questions there because we will have a short Q&A at the end. So our last speaker today is Paul Fitzpatrick, who's the president of Fitzpatrick Executive Advisory Group, LLC. And Paul, the mic is yours.
Okay, great. Can you see that?
Yes.
All right. Well, thank you very much, Anishka, for asking me to participate in this. So I'll start with giving a little background on myself and then talk about, I'm an entrepreneur, and I thought I'd go through my entrepreneurial experience and then kind of dovetail on two projects I've got going now, one here in Maine and one actually in Georgia. So I'll try to run through some of this pretty quickly. So PJ Fitzpatrick Executive Advisory Group, I provide fractional CEO services, board engagements to early stage companies, startups, primarily in healthcare services or medical devices. I actually live in South Thomaston, Maine. Currently, one of those fractional engagements is advanced catheter therapies, and I'm going to talk about that technology, which some of you may find very interesting. It's a drug delivery technology. But most recently, I've joined the team at Maine Center for Entrepreneurs with their new bioscience cluster initiative. And I'm going to, on a fractional basis, be heading up their bio startup program. I also am just been elected to chairman of the board for Life Sciences of Tennessee, and Anishka and I are going to talk about how we might collaborate BioMe and Tennessee as well. And I spend quite a bit of time mentoring other companies and participate in the Top Gun program here, Georgia Bio, and another organization, CoLab in Chattanooga. I'm a graduate of Northeastern as an alumni, and I was an adjunct faculty in their paramedic program for many years. So my main connection goes back quite a ways ago. It's really with Delta Ambulance Service in Waterville, Maine. I actually took, and this is going to really year date me, but I ended up taking the first paramedic exam back way when, and worked for Delta. And then, you know, I guess once you come to Maine, you become a lifelong Mainer, you know, although I'm from Massachusetts. And that's where I met my wife, Patty, and we've been in and out of Maine ever since. But my entrepreneurial experience really, I was thinking about this talk today, and it really actually started with my grandfather, who was an immigrant from Armenia a long time ago. And he came to this country and bought 100 acres of land in Andover, Mass, and started a farm. And so back in my teen years, I said, oh, maybe I could do something along that. So I asked, my grandfather passed away, so I asked my grandmother, hey, could I plow up a couple of acres? And so in my teens, I decided to be an entrepreneur in the farming agriculture business, and I plowed a bunch of acres of land and planted a bunch of vegetables and pumpkins, and was not a success in that area. That was one of my early learning experiences, because I'd rather be on my motorcycle going with my friends to the beach and such. But that did lead me to deciding to get into the world of paramedicine, trained in Los Angeles, came back to Massachusetts at a time where the industry was very much in its infancy. And I ended up getting involved and being hired to really do my very first startup, which was in Lowell, Mass, where a group of hospitals came together and they said, hey, we want paramedic service, hadn't been done yet. And so my job was to really take it from ideation through commercialization and design, develop, and implement that program, which I did that for a number of years. And then another group of hospitals outside of Boston gave me a ring and said, hey, can you do it for us? And that just evolved into a myriad of other opportunities. I ended up starting a consulting company, which led me to meet a fellow that was doing a roll-up play in the ambulance business called Careline. I ended up helping one of my other clients be acquired by that company, which then we ended up growing that by acquiring 36 companies, rolling that up, growing that to about 250 million in revenue or so. And then that went public and we ended up selling it to another company. We then started another company in healthcare called Healthcare Innovations, and that took us down to Georgia and started that program, grew that, ended up selling that about 5 years later. And that then led to another company called NeoMatrix, where I was the interim CEO. And this one, some of the other presenters may find interesting. It was a breast cancer risk screening device. And so I took and helped commercialize that, raise some money for that sort of thing. And in any event, it was a number of different companies that I've ended up starting, from iMedical Staffing, which was a nurse, international nurse recruiting company to address nursing shortage here, to Quantum DX, which was a diagnostic or is a diagnostic company, to a venture I'm still involved in, as I said earlier, advanced catheter therapies. And the only two ventures outside of healthcare that I've been involved in was my wife and I, back way when, decided we ought to be entrepreneurs in the bed and breakfast business. And we bought a little inn and started a bed and breakfast concurrently while I was trying to get this paramedic service off the ground in Lowell, Mass. So that's the Webster Lake Inn. And about 8 years ago here in Maine, we bought a couple of cottages and started a summer cottage rental business called Island View Cottages. So in any event, it's it's been a very rewarding road through entrepreneurialism. And one of the companies that I'm still involved in, which is ACT down Chattanooga, is a company that we started a number of years ago. And we did the sort of the Vulcan mind meld from Dr. Teeslink. And he had this concept of taking a catheter, be able to put it into a blood vessel and very targetedly deliver drugs, live cells, that sort of thing, somewhere either in the vein, the venous system or the arterial system, with very little to no systemic release. And you could use all sorts of different types of agents, including live cells and biologics. Today, that company is being commercialized. We've got 3 FDA clearances on that technology. We've got 15 patents issued around the world. We're starting to generate a little revenue. I'm also raising some money to build a larger commercialization team as well. So that's a pretty exciting technology that very pleased to see out and helping to save lives, in particular in PAD patients, peripheral arterial disease patients that have significantly limited blood flow in their legs. And the problem with that most people don't realize is that when you have poor perfusion in your lower extremities, it leads to amputation. Amputation, the mortality rates of amputation are extremely high, anywhere between 18 months and 5 years. Somewhere between 30 and 80% of those patients will die because of that. So if we can keep good blood flow in the lower extremities, we will save lives and limbs. But a more recent opportunity here in Maine, which I'm really excited about to help start up and get going, is with the Maine Center of Entrepreneurs with their Bioscience Cluster Initiative. And this is a collaboratory effort funded through an EDA grant and also matching funds from MTI and Focus Maine and Maine Health. And Maine Center for Entrepreneurs, MCE, many of you are aware of that organization, led by Tom Rainey, has a great group of folks managing the Top Gun program, the Cultivator program, and several other programs. And the whole goal of this program is to bring all of the resources that Maine has to offer, from R&D to technology to new companies, that sort of, and try to pull them together to help entrepreneurs in this space take their ideas from ideation and innovation through to hopefully exit and commercialization and exit. Real quickly, some of the elements of the program is we have part of the program is called BioInnovate. Tom Keeler with Maine Health will be leading that effort. But this is to take the earliest of companies here in Maine and help with ideation development, feasibility. Can you do the thing you want to do, that technology? Is it feasible to do that or create that or make that? Versus viability, which is there a customer base for it? Can you have a successful business for it? Will docs and other folks use the technology? IP, whether that be licensing or developing the IP from scratch, and proof of concept. Then we anticipate those companies coming into this program, the Bio Startup, and some of the elements of the program. And we see this as a 15-week program, meeting once a month and providing mentorship through the Top Gun program with Terry Johnson and Lori Johnson helping out there. But we're looking at developing business models, risk management, regulatory pathways, helping with reimbursement pathways, quality management systems. Then going into device or technology development, product production, data development, whether it be preclinical or clinical studies. We can assist or help the company get positioned to raise capital, which is can be an art unto itself. And then finally helping to commercialize and potentially exit. So those are the big pictures of the program. Very, very excited about participating in that. And I guess the last thing I would say is, and I think I'm out of time here, is that, you know, in terms of the entrepreneurial experience, it can be, as many of you know, super rewarding, but it does take the 3 Ps, which is patience, persistence, and perseverance to be successful as an entrepreneur, especially in the bioscience, biotech, medical device space, because there are so many additional hurdles that you got to get through in order to be successful and ultimately save lives and have a financial reward for all of your stakeholders. So if I can be of any help to anyone, whether it be through the Maine Center for Entrepreneurs, the Bio Cluster program, or otherwise, my contact information is up here. Feel free to reach out to me. Thank you.
Thank you so much, Paul. That was quite a journey. I didn't know about some of those things. I did know about some, though. I'm so excited that you're working with MCE now, and we're very excited about the Bio Startup Program and the Bio Innovate. If anybody's interested in connecting with the speakers after the event, please email us. We will share the contact information as well. This is what these events are all about, is to spark interest and, you know, start some new collaborations and meet some new people virtually, but that's the world we're living in right now. I saw there was a question from Dr. Christy Townsend. Maybe I will read it out. A theme with Andre and Karissa seems to be that images contain far more data than we can perceive at first sight. Are medical imaging technologies evolving faster than we can keep up with the methods for analyzing them? Is interdisciplinary science and collaboration with healthcare important to overcome this issue? And any of our middle speakers, if you're up for, you know, answering this question, please go ahead.
So I'll take a start at it because I saw that question come in. I didn't know who from, but in the comments, so I put a recent example of an article that is really, really cool. So I would argue that right now, current new novel imaging techniques are hopefully going to be introduced to the clinic, I think has turned into absolutely collaborative science, where you have people thinking about acquisition, you have people thinking about analysis, and you have people thinking about clinical utility. And it's really a team effort going into that. And a recent really clear example of that is coming out of Rice University. So they have, so in surgery, particularly cancer surgeries, right? People are always concerned about tumor margins. So they're actively resizing tissue, and then they're quickly slicing and running it off to the path lab to get, are my margins clear or not, right? I can't imagine. It seems like a very stressful situation. I'm not a surgeon, but so what they've created is they used a really simple phase mask, and they put that phase mask in, and instead of having to go slice it, you can go quickly understand. So they used artificial intelligence to understand what might happen, to pattern what phase mask should be used for this tissue. So no longer do you have to slice it, but they use this phase mask on the front end, and then on the back end for analysis, and they're mapping out useful information to the surgeon to get right away in that room without having to run across the hallway. So I think that's a really prime example. I posted the PNAS article about that. There are some, also I can find more kind of news articles about that. I have really cool videos about it, but I think absolutely, from my perspective as a biophotonics researcher.
Okay, thank you so much, Karissa. Would Andre or Kendra want to add anything at this point?
Sure, I can. I mean, to answer Christy's question, I think the clear answer is yes. The imaging has outpaced the analysis. And so we have more, in my opinion, more technology coming up. And we've been outpaced for us on the analytical side. There's more technology. And sometimes I feel like people use a Porsche to go from, you know, their house to the barn, meaning you have these really sophisticated imaging acquisition tools, and you basically look at what's the pixel value, and you do some really simplistic analysis on them. And so I think in our case, the breast cancer project, mammography was invented as, you know, you're using x-rays, and we know x-rays are good at catching calcium in bone, right? We knew that for a while. And they figured, well, let's try this on breast, and we can find calcification clusters. And so that was a really good, milestone. And then when there's a tumor or mass, it becomes opaque and it's easier to catch. And that was the purpose. And then you have other people like my lab and many, many other labs who want to try to look at this from a different perspective. And then we start to find that we're able to look at fluctuation and spatial organization inside of those pixels. And then we're making some new progress. And so I think one of the nice movements coming up these days is there's a lot, and I think this is coming late, but still better late than never. We're having a lot of databases being set up. NIH has really come in and decided to play the game now. And there's a bunch of new large archives where you have a ton of CT scans for the liver, a ton of CT scans for the pancreas, a bunch of mammograms, tissue samples, histology samples. And that's where other users can come in, labs like mine, and what we do with Kendra and others, and can go and freely access these data, and then they can try to launch their analysis. And that's where you don't necessarily have to work hand in hand with a healthcare provider or a biologist or an imaging person like Karissa. You can just go get the images yourself and then set up your ideas that way. I think that's going to lead to great advances.
Mm-hmm. Thank you so much. We have a couple minutes left. I see a question from Bethany Fortier to Janeen and Patrick. Janeen and Patrick, your co-working space is beautiful. With all the data about noise of shared spaces decreasing productivity, have you seen any evidence of that? And also, I wanted to ask you about your occupancy rate, and do you still have spaces available? I'm just curious.
Sure.
Yes. Oh, go ahead, Patrick.
No, you start.
Yeah, there is a lot of data to suggest that, and we are definitely cognizant of that when designing the space. There are a bunch of different factors in that. Basically, different materials and textiles. So making sure that we try to offset all the concrete that's within the space in different ways, making sure that there's better insulation in a co-working space is important. We are also working on using more foam, really dense foam, to offset some of the sounds that may be bleeding through. We definitely have some sound machines throughout. So there's intentional efforts that need to be made when you're creating a co-working environment to offer people some more privacy. We also do have these really great Room. They're called Room is the brand. Basically phone booths, if you will, where people can go in and have private conversations that cannot be heard from outside of it. So when people want really intimate conversations, they will go in there just to be extra careful if they needed to. So I think those are some of the ways that we try to navigate that.
Yeah, and that sound attenuation is everything. We also found that HVAC is very important to invest in, and I'm glad we invested in that long before COVID. There's 3 HVAC units on the roof, pumping fresh air from the outside in 24/7, and with pickups throughout the building, and then every office has its own screen window as well. So those are 2 things that we had to make sure to invest in. And then in terms of occupancy, our grand opening, Agnieszka, was March 18th of 2020. So we had to cancel our kelp cutting, because that was the same week that everybody was having to stop anything with more than 10 people. So our occupancy dropped to 18% by the time we could actually open June 1st. But we're up over 50 now. We're actually getting closer to 60% now. Even when we're at 100%, the space will likely only always be about 40% full. That's the same as in Iceland, because people are, working at their other locations and coming in here again, maybe 1 or 2 or 3 days a week. So yeah, but the place has a nice vibrancy to it now. And we'd love to have anybody who's interested, to come down for coffee, socially distanced, of course.
Yeah, and I just want to point out, Agnieszka, too, that I think with any space, it's really important that you're willing to adapt, right? So you design a space intentionally, but there's always going to be different things that you're going to notice after the fact that you're really going to want to be considering. And so I think that that adaptability is really important when you're designing or in a workspace that is collaborative, to really take what you're noticing and adapt along the way, which is really important. I think sound panels are really key too. Making sure that if you feel like your office is definitely echoey or not really doing well with absorbing sound panels is huge on the walls and from the ceiling, not just baffles, but also clouds. So I hope that helps.
Yeah, thank you so much, Janeen. I love, you talking about all the care that you took to actually create a space and think about all of these things that I probably would not be thinking about. And with that, I think we're going to end because it is 11. So if you need to run, thank you so much for joining us today. I saw a comment from Tom Rainey about MCE moving to New Ocean Cluster. That's really great news. And I think this coffee hour was particularly diverse. It was very interesting to hear from different paths of bioscience life. So we hope to continue working with you all, and we'll see you all in February. We're brewing up an event that will be centered around the COVID-19 vaccine. So please stay tuned. More information to come via email. Thanks so much. See you next time. Bye.